well. We will get started in just a few moments when Professor Azzopardi joins us. We'll just be around a minute or so before we get started, everybody. Thank you for bearing with us. Good afternoon, Professor Azzopardi.
Good afternoon, Mr. Duffy. How are you?
I'm very well indeed, thank you. Very well indeed. I hope that you are too. Thank you so much for joining me here today.
Fantastic. It's nice to talk about really nice things. I don't know how the weather is here, but we're having some lovely weather over here.
Well, I'm very jealous. I'm still in the UK, so the usual grey and cloudy skies. But hopefully we can visit you soon, and we can pick up the nice weather as well. So thank you for everybody who has joined us today. Today is, of course, May 22nd, M22 Day, International Stellar M22 Day. So we are you can see here by Professor Ernest Azzopardi. Professor Azzopardi, the skin surgeon on Instagram and through his practice, is a super user of our system based between Malta and the UK. So thank you again, Professor Azzopardi, for joining me, and looking forward to our discussion here today.
Of course. It's a pleasure to be here. Just get over the preliminaries. I'm pleased to say I am not a key opinion leader for Luminis. I'm here because I really believe in the system, and I think that it's a very nice system to have. It's a system which respects the physician and allows the physician a lot of discretion in its operation. So I'm more than happy to be here today.
Wonderful. Thank you so much. So as we dive in, Professor, I would really love to ask you about your experiences with the system. I know you've been working for some time with the Stellar M22. I wonder if you could tell us a little bit about your experiences with the device.
So, first of all, I've been born with Luminis 1, and then onto the Luminis M22, and now finally onto the Stellar. I think it is a very versatile platform which has allowed me to really target the core of the laser practice. As you know, I'm the laser lead for the United Kingdom, and my experience with the Luminis is a system which is powerful, it's reliable, and it's increasingly sought after for precision medicine because it allows us to really tailor its settings to the particular patient. And I know later we will be discussing about the darker skin types, etc., etc. But I've found it to be a system which tailors to my needs and to the needs of my patients very specifically.
Fantastic. So as you touch on to your patients there, I wonder if you could tell us a little bit about the most common types of conditions that you are treating in your patients.
Sure. So my Stellar is, I'm proud to have one which is fully kitted, and this means that we can use a resurfax, we can use a Q switch, I'll explain, we can use a long pulse and the laser, and we can also use an intermittent pulse light. And this gives us a lot of flexibility when we are deciding which treatments to use, and also gives us a little bit of backup. So we have quite a large population of Fitzpatrick type 2 skin, North Europeans. Obviously, things like rosacea come into mind with IPL, and also pigmented lesions. And I mentioned these together because there's a certain overlap as well over here. With the resurfax, we address the ravages of time, combining it with the IPL to have a double treatment, which really helps, in my opinion, to address the tone of the skin, but as much as the texture, but also to achieve a true rehabilitation of the skin, where you are actually almost harnessing the natural wound potential of the skin to almost bamboozle the skin to thinking it's been injured, but it hasn't really. What it does is take the stimulus and therefore it regenerates itself. And because it regenerates its own self, it creates its own collagen, its own elastin, and things will which properly done will last for a long, long, long time. And finally, in my opinion, slightly, if not quite underused, the Nd:YAG, which is a treatment which is typically used to address purplish vascular lesions, but sometimes we also address it to address some pigmented lesions as well. And all of them together form a formidable combination for addressing, I would say, about 60–70% of what we see in clinic. We then have the we then have the aesthetics. We then have the scars, which we also do with the same kit.
That's wonderful. So, I wonder if you can tell us some of the benefits for particularly complex cases that you see. Is there anything with the system which really enables you to address those complicated patients that may not have been possible to treat in previous generations?
So I think one of the key things which distinguishes the Stellar from any other platform is, and I see this really with a clear conscience, it really respects the physician. Okay, what do I mean? Any other brand, which of course we wish them luck, will push a button for you, will ask you to push a button, and there's one set of settings which you can't really change. And therefore the analogy which comes to mind is that there's only one hammer, and therefore every problem becomes a nail. And we know that in this day and age, especially when the emphasis is on precision medicine, is on natural look, and we know that this is possibly something which is destined to fail. Why does the M22 differ? The M22 differs because, let's take a very simple example, IPL, okay? It allows you to change a range of filters. There are filters like the vascular filter which have a double notch, allowing you to treat both one wavelength and another wavelength or set of wavelengths at the same time. And therefore it allows you also to address complex scenarios, for example, pigmentation and rosacea at the same time. If you look at the screen of any M22 on IPL, not only does it allow you to change the wavelength, it also allows you to change the pulse strength. So how much do you give in a single pulse? How much is the interval between pulses? How many pulses do you give? And even if this discussion is a bit technical, the point is that you really can adapt it to what you want to give the particular patient. We have lots of patients who have rosacea, who also have, for example, darker skin, and using particular sets of treatments, we manage to either treat the rosacea first, because of course we know that as an inflammatory cause, rosacea often brings about pigmentation, especially in those people who suffer from post-inflammatory pigmentation or melasma. We also then manage to address people with complex conditions like large congenital giant cellular nevi, and they say that these are nearly impossible to treat. Well, I've been treating them with the M22 safely and according to standards, without any special anesthetics except for a skin cooler on children as young as 5. And I believe that the fact that this machine also has an inbuilt cooling crystal, which, by the way, you can also change the size of, allows such huge versatility. Other questions, for example, sometimes you have a patient with both pigmentation and a lot of it. So, for example, background pigmentation and nevi, okay, seborrheic warts and all that. You can actually choose a particular setting which will heat up gently the simple sunspots and the seborrheic warts and use them as almost like a heater to diffuse heat gently over several days to the rest of the skin. And this not only gets rid of the pigmented lesions eventually, as they slowly flake off and disappear, but also helps to achieve a very minor thermal stimulus to the skin, which helps firm it up as well as give it that nice shine, which I believe is again, a technical term because it addresses the zone of grains. So the possibilities are not dictated by the limitations of the machine. The possibilities are dictated by your experience. And I think that was a key selling point to somebody who's practicing at, I hate to say it, my level of seniority, and you see my hair's fallen off now. At the amount of years I have been, decades now, I have been in this field.
That's wonderful. So you've touched a little bit there on.
You shouldn't laugh too much. My hair's gone, so's yours.
I know. Well, I think I'm further ahead in that loss than you as well, my friend. You've touched a little bit there on treating darker skin types. I know very well that in your practice you treat skin types Fitzpatrick level 3, 4, and even beyond. I'm interested to understand the results that you're able to achieve in those patients. Are you able to achieve similar results that you would expect in patients with a Fitzpatrick skin type 1 to 2?
Sure. So, as you know, I practice across 2 countries, so I see pretty much the whole spectrum of lesions. I see the very fair skin down to the really dark skin. Okay, so the idea here is whether we can choose the right patients, which is really important. Okay, it's all boils down to questions of right choice of patient, right kit, right experience, but it's really important to prepare these patients. So we have particular pre-treatment regimes, which makes it safe. Okay, we tend to treat color as the last thing because whatever treatments we do before might change the color, but sometimes you have patients where you must treat color first because that is going to be a key stage in allowing you to do the next steps. And for example, in this particular patient here, we have a scar on a patient who depends on her hands for a living. She's a physiotherapist by profession, and she is Fitzpatrick type 3 skin, likes the sun, likes to go outdoors. And you can see the tinge of brown on the ends, especially where she was burnt over here at the contraction site. And you can see that we've managed to achieve not only a scarless appearance, but something which makes me really proud, actually make this patient go back to work, use her hands, but also give her a skin texture which was better than what she had before. And we do this very simply by building up the treatments from according to our published protocols, which I'm very happy to share if anyone's interested. But essentially, first we treat the contour, then we treat the color, then the texture, and therefore every time we have a different approach to getting something done which the patient really appreciates and can actually tangibly see the difference of. And then, of course, we have the use of laser-assisted drug delivery, which we are quite happy to discuss, which basically means we use lasers to permeate the skin and therefore allow certain medications to pass through the skin. It's a very established principle. These days, certain medications will also allow us to treat much darker skin than before.
That's wonderful, and I know from experience that you are achieving some fantastic results, and it's really great. So thank you for showing us this one behind you just there as well. As we come to a close, I just wanted to ask two more questions, really.
Sure.
The first one I wanted to ask a few little comments perhaps on recovery time for your
Sure.
patients. Do you experience any significant downtimes? Do patients experience any discomforts or anything of note when you are treating them with the Stellar M22?
So by and large, this is a key point, and thank you for bringing it up. We almost forgot. It was a hard day today. So many patients are really scared of laser because laser has this stigma that it hurts, that I was hurt when I did my hair removal, and therefore this must be really hurtful. In practice, if you're doing it like you should, and you're a well-trained physician, then the answer is that I've rarely had treatments with the IPL whose downtime was more than a few hours. Why is this? First of all, the IPL is the M20 was built with certain safeguards. So if you're talking about a crystal, you're talking about a cooled crystal. So the patient is comfortable because you're delivering cooling at the same time as you're delivering the laser pulse. This both makes it safe because it's less likely to get a burn, but also makes it comfortable for the patient. Of course, we are well equipped with chillers and the rest of it, and we put particular emphasis on the post-laser regime. But I can say the same on the other aspects. I mean, if you consider it, the Q switch on the M22 doesn't even require cooling, really. And the most important thing is, especially now that we're coming towards the summer months, I emphasize you can do laser properly and safely in the summer months. And please, to note, I will challenge anyone to come to our clinics in Malta in the summer months when the UV index is 12 or more. It's not about the UV index, it's about choosing the right patients who will follow the right regime afterwards and being very conscientious about their creams and their sunblocks and their anti-pigmentation medication. Okay, so it can be done, very little downtime in the right patients and the right hands, lovely results.
Wonderful, thank you. And as just one final closing comment, Professor, I wonder if you could give any recommendations to any practitioners who are looking to choose a multi-application device for their clinic. Are there any particular points that you would encourage people to investigate?
I think it's a really important decision. If you're starting off, you'll be bombarded, they will be bombarded with adverts and pulls from all different directions. That's another later, by the way, we've done with the M22. It's a really important choice because you need to have a good business case before you buy the machine. And my suggestion is that if you're starting off, you must invest in a good multi-platform. It saves you space. We know clinic space is really limited, especially in central locations. So a platform device is going to save upon that square footage. You need to choose something which is well recommended to be safe and has certain safety build-ins. Now, yes, I know that I mentioned particularly advanced settings, but there is also a basic type setting which the machine can be locked to. So perhaps the practitioner who's starting will feel a little bit safer using the kit. And thirdly, I think it's worthwhile to note when you're buying, I think I have to say it because it's fair. When you are purchasing a laser, you purchase a laser where you know you'll be part of a family. So we all started off at once. We were all novices once. You can't know everything. And please do not make the mistake of thinking that you're going to go on a 2-day course and you're going to call yourself an expert in laser. I'll find out because patients will be burnt and they come to me for treatment then. You have to ask and you have to share your knowledge. And I think the Luminous community is very good at that, at sharing our community knowledge. We have a question here, in fact, I note from Dr. Patron, which settings do you usually use with resurfax when combining with IPL in phototypes 1 to 3? The question of settings, bit of a bugbear is that everybody wants to know the exact settings to put in the machine. I'll do a bit more than that. I'll give you principles. First of all, when you're combining treatments, you must be a little bit more careful, especially if you're combining treatments of the same type. Okay. Now here the question is resurfax and IPL, and really the question which I should ask is, what is the indication? The general principle is that when you are using an IPM, a resurfax, the higher you go on the density, the lower you have to go on the energy. Because if you don't, then there will be an overload of energy which cannot be dissipated quickly by the principle of using a fractioned handpiece rather than a full beam handpiece. For those who are interested, it's called the theory of microthermal injury, microthermal zones. If you combine this with IPL, then you got to accept that your level of risk is going to go slightly upwards. What do? You are going to start the treatments in a way which are safe. So you're going to first start with your resurfax treatment. Why? Because this will address water, okay, and it has much less of a problem with dissipation of heat because of the fraction pattern it uses. If you're going to do this on settings 1 to 3, then you may use it a little higher energy setting, but then correspondingly you have to bring down the density. Okay, so for example, if you're typically doing patients for writings or skin wrinkling on 25 millijoules at 150 spots per centimeter, I suggest you bring that down by about 25 to 50%. And then on the IPL, which is a block full beam device, then I suggest that you do this. Secondly, using a Zimmer cooler, and of course, you can go on and on forever about the settings, but the principle is that you're going to give enough time for heat dissipation. You're going to go a bit longer on the pulse interval, and this will allow heat to dissipate well between pulses. Whatever you do, please do not dry stack. Okay, so you do not double hit on the same area. Try also to cross your crystal on the skin, so you don't have the tiger tracks, which unfortunately I see too many of. And more importantly, listen to your patients. There is a reason why these treatments are done awake, and the reason is that you got to listen to your patient. You got to perform a test patch. If that test patch is done and is safe, then tell the patient you're not doing the test patch to test whether it's effective or not. You're doing the test patch to test whether it's safe or not. You've documented your safety intervals, yeah? So now you know, even if you've used resurfax and IPL together, you've documented the range of settings where it is safe for you. If the patient starts saying, ouch, my suggestion is you don't use that setting, you go 2 settings below, okay? And those are the kind of ballparks which I would suggest anyone who's starting to think about combining settings to go for.
That's wonderful. Professor, I know you are going back into clinic this afternoon as well, so really I want to thank you very much for taking some time out to come and speak with us today. To everybody who has joined us, I would like to continue to encourage you to share your results on Stellar M22 Day with hashtag M22 Day and hashtag Share Your Shine. If you have any further questions, please feel free to direct any of those questions to us through either the Luminous EMEA Instagram channel or through the Luminous website. One more time, Professor Azzopardi, thank you so much for joining me today. It's always fantastic to hear from you and to hear about the fantastic practices that you are running. So thank you very much again for joining us today.
Thank you for inviting me. I think I should be thanking you for the really fantastic educational work you do. I know that this is all excellent, so I think it's really nice to hear finally one laser company, and quite a leader at that, which really takes care of its education, the educational needs of its physicians, and who really delivers a sterling service in keeping those physicians properly trained and properly up to date. Thank you so much.
Thank you so much, Professor, and thank you to everybody who has joined us today. We look forward to speaking again very soon. Thank you
Bye
very much,
now.
Professor. Take care, everybody. Thank you.